I'm Dr. Bart. Thanks for spending a few minutes with us here today. Our topic for discussion today is going to be the state of healthcare in 2016. You're going to find our presentation is unique. We're bringing a lot of data, a lot of facts, and yet this is not a $1 million production. Our production is very grassroots and very humble, but I think you're going to find the content very interesting. Contrary to what most people in the United States believe, not all healthcare providers are millionaires. Healthcare providers' salaries are not the cause of ever-increasing costs of healthcare in the United States. In fact, you're going to find most healthcare providers are making a very modest salary. Healthcare providers are experiencing ever-increasing demands from the government in documentation, reporting, red tape, and bureaucracy. All of these things are preventing healthcare providers from doing their real job, providing healthcare for the people of this nation. During our discussion today, we're going to delve into what is at the real root of these negative changes in healthcare. At this point, we're going to convert over to our PowerPoint so you can really appreciate the detail and the facts of our discussion for today. These issues affect over 1.2 million physicians, another 3.3 million nurses and allied healthcare professionals, totaling over 4.5 million healthcare providers of this nation are affected by the facts we're going to present here today. Now, to delve in and really understand the state of healthcare today in 2016, we're going to start by asking three critical questions. We're going to define these in just a minute, and then we're going to see as we're working through the presentation how each one of these actually apply. So, our three critical questions. Number one, what defines a good leader or great leadership? Number two, what's the definition of national? Number three, what's a good pay raise? Certainly something that affects all of us. Let's define each of those three critical questions. The first one, what makes a great leader or great leadership? Some of the things we most commonly hear would be strong influence, the ability to have others follow you, or maybe the ability to complete tasks successfully, to get the job done. Also, leading by example. And of course, never asking troops, teammates, employees, other individuals you're working with to do more than you're willing to do yourself. Critical question number two, what's the definition of national? Checking Cambridge Dictionary, relating to all parts of a nation or the nation as a whole rather than any individual part. Simply put, including all people of a country or nation. More simply yet, everyone. Critical question three, what's a good pay raise? 5 to 6%? 8 to 10%? Some of you might be a little more conservative and say 2 to 3%. Research reveals the average annual pay increase in the U.S. is about 2.7 to 3.1%. Or to simplify it, the data reveals between 2 and 3% is an average pay raise here in the U.S. Let's ask a question. What if you receive 0 or passed over? What's that indicate? Does your employer appreciate or respect your work? A quick scientific disclosure. In healthcare or any scientific field, when we're trying to prove a point or a statement, we always point to the literature. We want to know what the facts and the data really indicate. Therefore, conclusions and decisions that we make are based on data and facts of the literature, not just our personal opinions. As we work through this presentation, you'll see I present all the sources for the facts and the data that we're about to discuss. I welcome and encourage you to review those sources and even do additional research on your own, so in the end you can be convinced of the validity of what we're presenting here today. Let's take a quick history review. Back in 1992, the Clintons made as one of their most pressing election issues healthcare reform and the national healthcare crisis. Shortly after he took office in 1993, Bill Clinton assigned Hillary to head up the healthcare task force since he was too busy with other issues, and as he stated, "With us you get two for the price of one." And hence was born the Hillary machine. In late 1993, Hillary and her task force had completed healthcare reform. We all remember Hillary was so proud of that proposal. But let's review a few of the details of the task force and what she really accomplished. This task force was a hand-selected and completely biased group featuring Ira Magaziner and many other politicians who'd been anti-healthcare provider for many years. The only representation for all healthcare providers was Atul Gawande, a Harvard medical student. All of healthcare was represented by a Harvard medical student? Hillary failed to assemble an unbiased, competent task force, and instead she put together a completely biased group of just her closest friends. A key question when we're reviewing the accomplishments of Hillary's healthcare reform proposal: what political party had control of Congress between 1992 and 1994 when Hillary was trying to get her legislation passed? Answer: the Democrats, overwhelmingly. Senate 56 to 44, House 267 to 167, as the data below shows. Even with a completely biased, hand-picked task force, no representation for healthcare providers, and an overwhelming majority controlling Congress by the Democrats, her own party, by 1994, Hillary's healthcare proposal was dead and abandoned. Hillary failed to get the Clinton healthcare reform legislation passed. So Hillary failed at two of our critical components of what's comprising a good leader: strong influence, the ability to have others follow you. She couldn't get her own party to vote in her favor, and the ability to complete tasks successfully. Obviously, her legislation failed. All the above factors demonstrate that when the time is critical, Hillary doesn't have the ability to get others to follow her and can't get the job done, even when she's got all factors stacked completely in her favor on her own pet personal projects. Since the Clintons could not get their health care legislation passed through as primary legislation, 3 years later they slid an alternative piece of legislation, the SGR, the Sustainable Growth Rate, through as a rider or a secondary piece of legislation on a much larger piece of legislation, the Balanced Budget Act of 1997. In other words, they had to sneak their legislation through. Now, let's ask a question. What is this SGR, the Sustainable Growth Rate? Trying to simplify it is basically saying when the national budget spending on healthcare grows more rapidly than the gross domestic product, healthcare providers are going to be mandated pay cuts. Leaving utilization rate as the real key factor to drive this SGR algorithm, let's take a look at a couple of questions. Utilization. Number one, do we have more health issues as we age? Yes, of course. Is our population aging and growing? Yes, of course. So since the answer is yes to both of those, are we going to utilize more healthcare services every year? Yes, of course. Higher utilization ultimately guarantees pay cuts for healthcare providers. Healthcare providers have taken between a 0.5 and 5.5% pay cut nearly every year since the Clintons passed the SGR legislation. However, most of these pay cuts began in years after they left office. The appearance? The Bush and Obama administrations have administered more pay cuts to healthcare providers under their presidencies. However, the reality? This is due to the Clinton SGR legislation. This is just a prime example of how the Clinton political expertise in maintaining their appearance of never passing damaging legislation, well, in reality, they're passing the consequences of their actions on to the next guy. Yet another hindrance introduced by the Clintons are the ever-increasing reporting and documentation demands on healthcare providers. This red tape and government bureaucracy prevent healthcare providers from performing their real job, taking care of the health of the American people. Earlier, we saw the average annual pay increase in the U.S. is about 2 to 3%. We also asked the question, what if you received zero or were passed over? Now with everything we've seen, we can take this one layer deeper and we can ask, what would it indicate if you were forced to take pay cuts every year for the last 20 years as healthcare providers have? The Clintons have certainly demonstrated they have absolutely no respect or appreciation and put no value on the service healthcare providers provide to this country. Let's revisit our second critical question, the definition of national. Simply put, we said it means applying to everyone. Now we've seen how healthcare providers were affected by the national healthcare crisis with pay cuts for the last 20 years. But what about the rest of the nation? How was the rest of the nation affected by this national healthcare crisis? Were landlords or mortgage companies forced to lower the payments healthcare providers were paying for office space? No. Were vendors that healthcare providers purchased their supplies from forced to lower their rates? No. What about utilities, electric, water? Were they forced to lower their rates for healthcare providers? No. What about student loan companies? Were they forced to lower interest rates? No. Were totals that student loans can climb to with compounded interest capped? No. What about rates of malpractice insurance? Were the carriers forced to lower their premiums for healthcare providers? No. What about malpractice cases? Was there any tort reform that lowered the total amount of an award? No. Absolutely no other business or industry was forced to take a pay cut or lower their fees. No other business or industry was affected by the national healthcare crisis. Now, this is a strange implementation. Why? Damage control. The Billary machine attacks only one group, but severely, thereby minimizing the amount of political damage and the number of voters they might adversely affect with their policies. It's always about what's in the best political interest for the Clintons. Let's revisit critical question number 1, the attributes of a great leader. Now, we saw from the failure of healthcare reform back in 1994 that Hillary definitely lacks strong influence and that ability to get the job done. But what about our first two, leading by example and never asking others to do more than you're willing to do yourself? Let's look at a critical point. In the very same years the Billary machine mandated pay cuts for all health care, the Billary machine did not step up and take that same pay cut themselves. In fact, in many years, our leadership gave themselves pay raises at the very same time they ordered healthcare providers to take a pay cut. So now we really see the true leadership example of the Billary machine. They're going to ask others to do more than they're willing to do themselves. So by our very definition, what does this say about the leadership of Hillary Clinton? Let's delve into the president's annual salary. We can see from the graph below that from 1969 to 2001, the president's salary was $200,000 a year and a bump in 2001 to $400,000 a year, never taking any kind of a pay cut. Digging even deeper, in 1999, just 2 years after the Billary machine passed the SGR legislation that condemned healthcare providers to a permanent pay cut, they increased the president's salary from $200,000 a year to $400,000 a year annually. The Clintons couldn't find any room in the budget for health care increase, but they certainly found enough room in the budget to give the president a 100% pay increase. A prime example of the Billary leadership, do as I say, not as I do. We're really beginning to see they consider themselves elite, the ruling class. An interesting question. Why did the Billary machine make the change to the president's salary in 1999? Their term ended in 2000, so why would they make this change basically at the end of their reign? Answer: they took advantage of the former President's Act. That act basically said that a past president receives a pension that's a percentage of the current president that's in office. So the greater the pay of the current president, the greater the pension for past presidents. So this move was completely self-serving. Basically, they increased their own retirement and increased their own pension. Hillary is an expert at taking care of herself and her own personal advancement. Hillary certainly finds endless funding for herself, her election, and to put herself in power, since she's elite and ruling class. She funds herself while simultaneously mandating others take pay cuts. Recent article in USA Today: Hillary raises nearly $90 million. $90 million for her campaign and to put her in office. $90 million have been raised by the Democrats to get their candidate in office so politics can continue on as they have in the past. So the elite, the ruling class, can continue to dictate to the rest of the country what you should be doing, what has value, and how you should be living your life. Even if you're young, healthy, and have no interest in healthcare, you've still seen examples of the Hillary machine's leadership. They'll target and attack a single group as they have healthcare providers. For everyone in the nation, the most critical question is, who's next? Hillary's already spoken out against several groups that, in her opinion, are obsolete or should be replaced: coal miners and others. To the Hillary machine, everyone is expendable. Everyone can be eliminated. The most burning question: are you next? We've presented some startling data, facts, and evidence here today. What's our call to action? Number one, healthcare providers must unite to fight the past actions of the Clintons. Healthcare reform of the Clinton and current policies is imperative. Minimally, Hillary has no respect or appreciation for healthcare providers and the service we provide for this country. As seen by her failure to get her initial healthcare reform policies passed back in 1994, Hillary lacks strong influence and fails to get the job done. We've also seen Hillary does not lead by example. She gave herself a pay raise at the very same time she implemented pay cuts to others. Therefore, we see Hillary as one of those who asks others to do more than she's willing to do herself. More recently, we've seen issues with Hillary deleting and hiding emails from our own government agencies. This shows she's dishonest and can't be trusted. Bill Clinton even coerced the FBI to exonerate her. This is just a despicable example of abuse by the ruling class elite Clintons. More recently, we've seen that Hillary even skipped mandated ethics training. All of these examples and many more demonstrate the real root of the issue. Hillary considers herself elite, ruling class, better than her subjects, which happen to be all the rest of us, the people of the United States. And most critically, she feels she's above the law. All of this makes Hillary dangerous for America. We cannot allow her to regain control of the country. We cannot vote for Hillary Clinton. Now, based on the information, data, and facts presented here, we've seen that the Hillary machine has driven and been responsible for many of the negative healthcare changes we've seen over the last 20 years. We've also seen detailed examples of how the Hillary machine will govern based on their first time in office. Considering all the evidence, simply the Clintons are dangerous. We cannot allow them to rule again. Now, this was the first part of our series. Part 2 will be available shortly, so please check back with us soon. This is Dr. Bart. Thanks for spending time with us.